Welcome to Dr. David Eifrig's Health and Wealth Bulletin, a publication from Stansberry Research. This is Weekly Update. Here at Weekly Update, we look at stories dominating the news cycle and tell you our takeaway. Our goal is to give you the best information we can to empower you to take care of your health and your wealth. But we don't shy away from the harder subjects. And this week's topic isn't an easy one. In fact, we need to warn you that it might be difficult for some of our viewers. But we encourage you to learn more about the subject and help break the stigma. Last week, we lost two celebrities to suicide. Fashion designer Kate Spade and travel guru Anthony Bourdain both took their own lives just days apart. Their deaths have opened the conversation about suicide. And what's more, that same week, the CDC released a report showing that suicide rates in the U.S. have increased more than 25% since 1999. That means we're losing about 41,000 people each year to suicide in the U.S. It's a terrible statistic. And in the past 2 years, we've seen spikes in folks reporting higher stress levels. And unrelenting, untreated stress contributes to depression. In fact, in May, Blue Cross Blue Shield released a report that depression diagnoses rose 33% from 2013 to 2016. Today, we want you to know what to look for and how to take care of yourself should you experience depression and/or have thoughts of suicide. The first is to make time for stress relief. Stress, as we mentioned, contributes to both depression and anxiety. Now, remember, self-care isn't selfish or some kind of fad. It actually involves proven ways to calm stress and help your brain stay healthy. 3 tips we've recommended include exercise, because getting just a few minutes a day gets your endorphins going. Walking, especially in the sun, helps produce healthy levels of serotonin, which keeps your brain healthy. Eating well is another tip. Foods high in trans fat increase inflammation, and they pump up our cortisol levels. Cortisol is our stress hormone, meaning higher levels accompany higher stress. So foods to avoid include processed foods and those high in refined sugar. Yoga and meditation is our 3rd tip. Both practices promote the relaxation response, which calms our overactive minds. Yoga also promotes healthy breathing techniques that you can use to quell panic attacks. Now, the next step is to recognize signs of depression. And I have another terrible statistic for this. 1 in 5 Americans will suffer from a mental illness this year. The 2 most common are anxiety and depression. Now, we've talked before about how unchecked mental illness contributes to dementia, but it also leads to suicide. One study recently claimed 54% of suicide victims had no history of mental illness. But here's the thing. We know that millions of Americans suffer from depression without getting a diagnosis, and even fewer get treatment. There's even a range of depression disorders, including things like episodic depression, which hits in shorter bouts and is often triggered by a crisis event. And people who suffer from these are less likely to get treatment. That's why a suicide number that we mentioned earlier is likely higher. According to the director of the National Institute of Mental Health, Joshua Gordon, 54% is a bit misleading. As he told the Washington Post, when you do a psychological autopsy and go and look carefully at medical records and talk to family members of the victims, that number's closer to 90% who will have evidence of a mental health condition. Now, the disconnect here is that too few people get help for mental health problems. For older folks especially, this is due to the stigma around it. They might think about a few decades ago when patients were forced into asylums and our standard of care wasn't anywhere near where it is today. And that's the idea that having depression means you're weak and broken or that you're just complaining. And that's an idea we need to stop. Mental illness is just as serious as any other illness in your body. You need to care for yourself to be healthy the same way you would for heart disease or COPD or diabetes. Depression symptoms include feelings of overwhelming sadness and a lack of interest or pleasure in your usual hobbies or activities. But for many, there are other symptoms as well. For instance, sleeping too much or suffering insomnia, gastrointestinal problems, aches and pains, even memory loss, all come from depression. Now, as we wrote about in yesterday's issue, older Americans face high rates of suicide as well. In fact, those 85 and older have the highest suicide rate. It's 50% higher than the overall rate of the rest of America. Now, part of that is the feeling of losing control over your decisions, your health, or your social life. That's why we encourage our readers to take control, organize things like healthcare directives, save for retirement, and make a plan for future healthcare costs. And remember to stay active and social. It's incredibly hard to get up and get out when you suffer from depression, but even taking small steps like calling a friend or taking a walk will help. Our next point, if you're having these thoughts or think you're suffering from depression, don't be afraid to talk about it. Find a friend, a family member, or a trusted leader in your community to talk to without judgment. And if you don't have someone like this in your life, find a counselor or a therapist. In fact, a licensed provider can also provide coping strategies and referrals for medical care. Remember, there is no shame in seeking help. Remember, you need to see your primary care doc or a psychiatrist for any prescription. But as we've said before, we really encourage you to try counseling before medication. Medicare also does cover some mental health services, and many insurance companies will cover at least a few sessions. So be sure to look for what they provide, and they might even have some resources on their websites. Finally, if you've thought about suicide and have a plan, please seek help immediately. There are crisis lines you can call, text, or even chat with online. They'll connect you with a counselor to help you talk about it. We've got their contact information on the screen now. They include the National Suicide Prevention Lifeline, and of course, call 911 if you need immediate help. Do not ignore signs of depression in yourself or in others. Take the time to treat yourself kindly and seek the help that you need. This video is just the start of a larger conversation. Don't be afraid to discuss this with your friends, your family, anyone else that you might need to. And please don't give up. Share this video and let others know there is help and hope out there. That's it for today. Please like, share, and subscribe, and we'll see you next week.